finding out that we were heading towards another lockdown. Just days after the Prime Minister had said categorically that there wouldn't be another lockdown. He said it repeatedly, and they would avoid a lockdown. Talked about a damaging lockdown to Sir Keir Starmer at Prime Minister's Questions just 11 days ago. And there he was on Saturday saying we're heading back into lockdown, a 4-week lockdown until December the 2nd. But then yesterday, Michael Gove, that was a cabinet minister, was on television saying he couldn't guarantee it would end on December the 2nd. Rishi Sunak, the Chancellor, this morning have said it will end on the 2nd of December. What are we supposed to think? Brendan O'Neill joins us. He's editor of Spiked Online. And I know just from your and my text messages to each other over this weekend that you are as depressed and indeed angry as I am about the whole thing.
I think it's a disaster. It's an unmitigated disaster. I just think that the government is making a terrible error. And the most depressing thing is that the government doesn't seem to have learned anything from the first lockdown. It hasn't learned that how destructive lockdowns can be in terms of lives, livelihoods, the economy, healthcare, cancer diagnoses being missed, cancer treatment being missed. I mean, these are really destructive consequences. And also, it hasn't learned that you shouldn't terrorise your citizens. I mean, those statistics that Boris Johnson used at Downing Street, we know that many of them are already out of date, and the newer statistics are far more optimistic. They've obviously chosen particular numbers to try and terrorise us into obedience. That is not how you should treat your citizens.
No, and we went over those statistics with a number of experts today, including Professor Carl Hennigan, a Professor of Evidence-Based Medicine at Oxford University, and he debunked those straight away. This is the bit I don't understand. At the beginning of the first lockdown, now you were always a lockdown sceptic. I wasn't. I thought it was probably the right thing to do, probably on balance. I was already ill myself, and basically it was about building up capacity, flattening the curve. But it was quite clear, this would just be only one lockdown. Otherwise, there's no point. You can only do it once. It only works once, as we were told again and again. But I trusted everything that Chris Whitty and Sir Patrick Vallance said. These are eminently well qualified people. They seem to me to be very trustworthy. I'm now looking at things that they say, that the 21st of September graph of doom from Vallance, which predicted huge numbers of positive test infections, 49,000. Well, we're only at 22,000 now. Yes, he predicted 200 deaths a day. Well, we did reach that, but not by the time he said. And anyway, big question marks, COVID deaths from COVID, of COVID, with COVID, big question marks. But the figures they put out on Saturday were debunked within hours.
Yeah.
Okay, if they can be done within an hour, if they were going on information that was 3 weeks old and that information had already been updated, how did they not know that? And if they did know that, how could they go on national television and use those figures?
See, that's the thing. That's what I'm wondering. I think they did know, but I think there is a habit now amongst people in government and some of their advisors to choose numbers that look really scary and to publish graphs that look really scary because they need us to comply with these lockdown measures at a time when lots of people, are sick and tired of lockdown and are desperately worried about their futures in terms of their jobs, their income, everything. So they need us to comply, and this is how they're doing it. And I thought it was really striking that so many ministers, Boris himself, also Michael Gove, are now using the phrase, there is no alternative. This real fatalism has crept into this discussion, the idea that this is the only way you can deal with a virus like this. There's no other way. That's not true. We have to learn to live with this virus now that it's become part of the family of diseases. We should shield the vulnerable. We should take sensible measures. But there is an alternative to shutting down economic life, shutting down public life, and forcing everyone to stay at home.
And this is the thing, whenever I have this debate with people, I just find it intolerable. People go, well, we can't just let it rip. There is nobody sane saying let it rip. Nobody sane thinks this is a hoax and it's all a conspiracy. It's a real virus. It kills real people. I know people who have died of it. I've had the virus myself. But there's a difference between saying this is a deadly virus and saying this is a deadly virus and we should therefore shut down our economy and risk the deaths of many thousands more people from mental health problems, from cancer that's untreated, heart disease, and dementia, old people dying alone in their care homes as well because they're not allowed to see their families regularly. It's just out of all proportion, isn't it? Back in 2000, just not that long ago, we had something like 40,000 flu deaths. I was a political editor of a national newspaper then. I don't even recall writing about that, let alone that anyone was talking about a lockdown.
It's completely out of proportion. And you know, those people who say that people like you and me, we just want it to let rip and we don't care if people die, that is so untrue. It's just a
But
defamation that they
well, it's
use against
obscene to
anyone.
claim that, isn't it?
Yeah, it's a lie, and it's just against anyone who dissents from the narrative. That's what they say. But, you know, it can easily be turned back on them. Do they care about the people who will die as a consequence of lockdown from mental health problems, despair, poverty, cancer, all sorts of problems? The thing is, I increasingly think there is a section of society who are insulated from the worst impacts of
Yeah.
lockdown. Generally, well-off people, political people, the expert classes, you know, fancy journalists, they don't have the worst aspects of this lockdown. We know that it disproportionately affects less well-off people. Less well-off children's education suffers, less well-off people lose their jobs, they lose their incomes, they might lose their homes. This is what's going on. The people who are most keen on lockdown are the people who can afford to have a month at home, but there are millions of people out there who cannot.
Absolutely. Brendan O'Neill, really appreciate you joining us, as always, editor of Spiked Online Talking Sense.